Mr. Chairman, Ranking Member, I think most everyone knows I'm an ER physician, cancer survivor. I'm the father of a cancer survivor. I'm also the founder and CEO of a healthcare company that when I left employed over 1,000 medical providers and saw 1.5 million patients or so a year. I love caring for people. I love being a doctor, so much so that I started free healthcare clinics in Clarksville, Tennessee and Memphis, Tennessee. I do care, and my opposition to the ACA is because I think the ACA is going to crash the very system that today's witnesses have praised. But first, I want to tell everyone about a shift I had in the ER. My first patient was a gang member. He'd been shot in the lower abdomen. The guy was punching at the staff and yelling at us all. Meanwhile, we're trying to save his life. After giving this guy world-class care, I walked out thinking, man, at least with government payer, I'd get paid for the risks taking care of this patient. But near the end of my shift, I had a woman who had just a few days prior gotten her dose of chemo. She was febrile in what we call neutropenic fever, as the chemo had lowered her immunity system to a point that small infections threatened her life. With her were 2 children and a worried husband. The woman was only 35 years old. She didn't have insurance. As we stabilized her, I realized that early detection had saved this young woman's life. In Europe, socialized medicine has delayed early detection as care is rationed, and that's why mortality rates for specific illnesses are far better in the United States than they are in Europe and Canada. That woman would not have received timely detection there, and her chances of survival would have been significantly less than a socialized system. I was working at an ER and met a patient who was a CEO of a major corporation in Canada. He had a laceration. He hopped on his personal jet, flew to Nashville, Tennessee, and came to my ER because he could have been seen faster flying to the U.S. than waiting on a government-run healthcare system in Canada. True story. In Canada, you can get an MRI for your dog that day because there's a free market in veterinarian care. But you can't get one for grandma's knee. You're going to wait 6 months. Socialized medicine does not work. It does not provide better care. Study after study has shown Medicaid patients have equal outcomes to patients without insurance at all. Those are the real numbers. The ACA is not socialized medicine. What it does is it takes money from taxpayers and increased rates for small businesses. Yes, it has raised rates. I was on the insurance committee of Tennessee State Senate. We had to improve those insurance increases, hundreds of percent, and it takes those cost-shifted dollars and gives that money to patients who can't afford care and allows them to do what? Purchase health insurance and participate in the incredible care other Americans are getting, either through their employer or out of their own pocket. But unfortunately, that isn't going to last. You've given great testimony about how it works. It's not going to last. You see, either by intention or accident, the ACA creates pressures on the healthcare system that are crashing the very system that the witnesses today were praising. You like your ACA insurance-based care, and I appreciate you sharing it today, but ACA is driving the cost shifting to a point that small businesses can't afford it, and more people are shifted to government systems. As this dynamic pushes people onto the government care, Medicare, Medicaid, all of that, we move to more and more socialized medicine. And at some point, the shifts cause the system to crash. That means the insurance-based system that the ACA is providing you and that you've given great testimony on today is going to go away. It can't last. But maybe that's exactly what the leaders of the Democrat Party want. Medicare for all will be abysmal. It will be akin to the VA. I'm a veteran. I know. Ask your veterans. $32.6 trillion over 10 years. If you tax 100% of income earners at the top levels, you only get $700 billion. $700 billion versus $32.6 trillion, it doesn't add up. Yet the ACA is driving us toward that system, I repeat, either intentionally or accidentally. The government is not the answer. Government health care is rationed care, late detection, and worse mortality. We need solutions to health care. And my plan, I have written, and it's a bill this year, to create a health care swipe card, unlike what Mr. Sarbanes said, would fix the problem and allow us to provide help to even more people. And I encourage particularly my freshman Democrats to go look at my plan. I think the people that I've talked to love it, even Democrats. But the health care you're getting is insurance-based. You love it. You want to see it continue. Help us get rid of the Affordable Care Act, which is driving us to a single payer. Thank you.
All those